Good afternoon, Ms. Butler. My name is Student Nurse Diana Williams Marshall, and my group will be presenting on neurological assessment of the elderly. My part in this presentation is the assessment or the preparation process of the assessment in the elderly. This framework involves gathering certain tools. The conceptual comprehensive geriatric assessment involves several processes of care that is shared over several providers in the assessment plan. The overall care rendered by the team can be divided into 6 steps: data gathering, discussion among the team, increasingly including the patient or caregivers as members of the team, development with the patient and or caregiver of treatment of plan, implementation of the treatment of plan, monitoring response of the treatment of plan, and receiving treatment plan. Each of these steps is essential in the first process or in the process to a successful assessment. Although the amount of important information may seem overwhelming, formal assessment tools and shortcuts can reduce the burden on the nurses or the nursing student conducting the assessment. A pre-questionnaire is a good tool to use in order to get information pertaining to a patient. These questionnaires can be used prior to gather information such as past medical history, medication, social history, review of system, as well as gather specific information pertaining to the patient's health. The ability to perform functional tasks is needed for assistance. A fall history, urinary and fecal incontinence, pain, sources of social support, particularly family or trends, depressive symptoms, vision or hearing difficulties, whether the patient has a durable power of attorney for health care. Some of the major components involved in assessment, geriatric assessment, neurological assessment, is to gather information or to evaluate functional capacity, fall risk, cognition, mood, social support, financial concerns, goals of care, and advanced care preferences. Additionally, some of these components may also evaluate nutrition, weight change, urinary incontinence, sexual function, vision and hearing, dentation, living situations, or spirituality. In gathering information for the comprehensive assessment of the elderly, it is important also to know the functional status of the patient. Functional status refers to the ability to perform activities necessary or desirable in daily living. Activities in daily living includes like bathing, dressing, toileting, maintaining continence, grooming, feeding, transferring, like moving from one place to the other, and be able to go out and shop, using the telephone, be able to do little home repairs to see if they have that ability to maintain these functions of daily living. In preparation for the actual examination of the elderly patient, some of the tools you will need: reflex hammer, a tuning fork, a ophthalmoscope, a pocket eye chart for testing near or far vision, cotton swabs, tongue blades, and safety pins will be also provided to test sensation of the skin. The most important tool or information needed when you are preparing to assess a patient, whether it's an elderly, a young patient, neurological, or whatever the assessment process is. You always have to remember the important steps before you even reach your patient to wash your hands and introduce yourself, inform the patient about what you're going to do, observation, know what you're looking, not say exactly know what you're looking for, but trying to gather objective and subjective reporting from the minute you see a patient walk in, or if it's in a hospital setting, before you actually go and introduce yourself to your patient. Observation is one of the main steps in preparation for your neurological assessment on this patient. The actual assessment steps should be better explained by the next presenter.